Hi, everyone. This is Bill Elliott here from Wisconsin Hotel and Lodging Association. Thank you for joining us today. I see we have people trickling in here now. We'll give it 1 second. But, this is our second presentation in our In It Together series, series that we put together to make sure that that we're all united together as we're moving through this pandemic and hopefully coming out of it pretty soon. Having said that, I'd like to introduce our friends here from Blue Canary. They're going to be talking to us today about guest room disinfection. And here to kick it off is going to be Dan Ryan, the co-founder of Blue Canary. Just a little background on Blue Canary. Blue Canary Solutions brings methods, protocols, compliance, and training to hotels. Using healthcare-proven systems, Blue Canary helps hotels consistently achieve the highest levels of safety. They're an official strategic partner of the Strategic Lodging Congress. So having said that, I'm just going to take a moment before I turn it over to Dan, just to remind everybody or let you know if you've never been on one of these before. We love to have a Q&A at the end of these calls, and there is a questions panel here. All you need to do is type your questions into there, and the staff will be monitoring that at the end of the event. We'll go through the Q&A with Ashley. So without any further ado, Dan, the floor is all yours.
Oh, thank you very much, Bill, and thank you very much, Bill, Monica, and Connie, for helping organize this wonderful event. So we at Blue Canary are in the midst of witnessing a sea change in how hotel rooms are cleaned and how hotels are keeping their teams safe and guests safe. So our goal and outcome of this is that you walk away with a new knowledge base and desire to keep your teams and guests as safe as they can be. I'd like to introduce Ashley Sainsky. She's one of our experts leading many of our programs around the country. She started out in housekeeping, and she is an incredible expert on all things regarding infection prevention. In our experience, every hotel has the right product and amazing people. What we're seeing is a need to strengthen each hotel's processes through education and ongoing coaching. Please remember, if you have any questions that come up, please type them into the chat box and we will try to get to each one. And now, without further ado, I will hand it over to Ashley Sainsky, our expert.
Hi, and welcome everyone. Again, I'm Ashley from Blue Canary. A quick background on me is that I have been in healthcare for roughly about 10 years. So as I go through this presentation, you may hear me accidentally use the word patient instead of guest, so please forgive me. I started from a housekeeping manager to department auditor to a hazardous materials officer. And I've been all the way from the south side of Chicago to now sunny Orlando, Florida. For my last 4 years, I focused mostly on protocol development, onboarding, and quality control. I split my time between the Orlando Hospital of Veterans Affairs, the VA hospital here in Orlando, and then Blue Canary clients. So my goal today is to walk through a lot of the whys and provide guidance as you navigate these uncertain times. And like they said, as you go along, if you have questions, drop them into the chat and I'll try to address as many as we can towards the end. So let's jump right in. Like hospitals, hotels deal with a wide variety of pathogens, high turnover, and the constant need to provide a safe environment. Luckily, in many ways, healthcare standards are very easily transferred to hotels. So today we're going to discuss different pathogens and how they're spread, understand what it takes to keep hotels safe for guests, and discuss best practice techniques for cleaning and disinfecting, and discuss different auditing techniques, training, inspection, observation, and testing. The world right now is in cleaning theater mode, meaning everyone thinks they have the best practice or the why behind what they think is the best technique. So most of us have probably seen the person at the register wearing gloves while they check us out of the grocery store, and they touch every single grocery item with those same pair of gloves. And then they put it into our bags, then it goes into our car. And it doesn't make the most sense as they touched all of our items or the coffee they just made us with that same pair of gloves and touched the credit card machine or the cash. And while the thinking behind putting that plastic cover on the credit card machine was done with the best intentions, the plastic isn't really the best idea to prevent the spread of pathogens. And if you even ask the person who might be wiping off your grocery cart why they are doing what they're doing, or what chemical they're using, or how long does that chemical need to sit, most likely you won't get an accurate answer. So coming from a healthcare environment, the cleaning theater is never allowed. People are not only observed constantly, the techniques are tested and then validated by infection rates going up and down. So I am so glad everyone's on this call, because resorts and hotels should have always been and be performing these best practices to reduce the spread of pathogens, not just now, but always. So first, we need to know why we're doing what we're doing. Pathogens. That's the most basic answer. More specifically, bacteria and viruses living in our spaces that we need to help control or destroy. So in healthcare settings, we actually use the term kill. So you're going to hear me say we need to kill that pathogen. And pathogen is an umbrella term. It includes viruses, bacteria, fungi, worms, protozoa, prions. But we're going to mainly focus on these two types today, bacteria and viruses. Bacteria are tiny microorganisms that are made up of a single cell. They can live on any conceivable environment, including in or on the human body. And viruses, they're another type of microorganism that are parasitic, meaning they have to have a living host. They're living cells that need tissue in which to grow. Many bacterial infections and viruses are contagious, meaning they can be transmitted from person to person, and this occurs with contact with blood or body fluids, sexual contact, or with surfaces contaminated with the bacteria, such as doorknobs or faucet handles, a lot of which we touch all day long, and then we touch our face, nose, or mouth. You know, we dig that popcorn out of the back of our teeth. So in order for these pathogens to survive and thrive, they have to follow the chain of infection. The chain has 6 links, as you see on the screen here, and each link has to be present for a pathogen to thrive. So only one time does a link need to be broken in order to stop that pathogen in its tracks. And this is fairly easy to do. For instance, say you have the pathogen norovirus. All you need to do is just hand hygiene in order to kill that virus, or wear a mask so there's no portal of exit. Someone can't sneeze or cough it out. Another example, at a previous hotel I worked at, we actually had an outbreak of C. diff. I don't know if you've heard of C. diff before, but it is a spore that lives in the GI tract, and it causes extreme dehydration and pretty much explosive diarrhea, so much that patients can actually die. But we actually had to switch our disinfectants for a time until that specific pathogen was under control. But that's another example of what change can be made in order to break the chain of infection. So as you can see, there are many options and ways to break this chain and kill an infectious agent. So ask me any questions in the chat if you want to know more about breaking the chain of infection. But for a quick summary, we're going to talk about 4 pathogens that are highly notable in healthcare, but also in hotels. First is norovirus. So I don't know if you've heard the term norovirus before or not, but I bet you've heard of an example. So if you've seen on the news and you heard of a cruise ship out to sea and it had to turn around with 400 passengers that had flu-like symptoms, most likely that was norovirus. It's known as the cruise ship virus. This one doesn't have an antibiotic or a vaccine. Guests just usually have to ride it out, meaning they're going to be in their stateroom sick or in a hotel room sick until they have passed this pathogen. Next is salmonella. Now this one can be transferred by food and feces, or after someone uses the restroom and doesn't wash their hands. And only in severe cases, someone is actually admitted to the hospital. So again, if someone is at your hotel, most people have to just write it out in their hotel room before they go back home, or they check out early and go back home. So how are you protecting your team? So if you find that in the public restroom, they are cleaning up someone's accident, say they had a diarrhea accident, and does your guest or does your team member know to change their gloves after doing that each time? When exactly do they need to change their gloves to keep other guests safe and keep themselves safe? Next is athlete's foot. This is a fungus that can cause jock itch or ringworm. It survives in warm, moist environments. It's spread by direct contact by particles that are left on towels, shoes, floors, gyms, and equipment. And if your hotels are kind of like the current state of Florida, meaning they are wide open and hot, if your gyms and hotels are like Florida, then this is one you definitely want to be concerned with. And lastly, COVID-19 or coronavirus. It's a variation of a coronavirus. This specific strain causes a respiratory tract infection. It's spread by person-to-person contact via respiratory droplets. This virus can lead to pneumonia, septic shock, and death. And performing hand hygiene, wearing PPE, and staying away from people until the infection takes its course will break this chain of infection. So with all these pathogens I just listed, you can actually break their chain of infection or their life cycle by just breaking one link. So whether it's just performing hand hygiene or using the correct disinfectant correctly. So this hierarchy chart demonstrates the level of disinfectant needed to kill specific pathogens. I actually really like this chart because it's very useful to show us that most viruses, so if you look down at the bottom of the chart, see where it says vegetative bacteria or viruses at the very bottom, it shows us that MRSA, HIV, COVID, even Ebola virus is actually very easy to kill. All you need is a low level of disinfectant in order to kill that virus, which most likely you are already using that in your hotels already. So all the companies that make, the big companies, Diversey, Kimberly-Clark, 3M, Ecolab, they all make a hospital grade disinfectant that's pretty versatile for surfaces, that's been proven to kill all these viruses. And again, you might already be using it. Using the chemicals correctly is the key to breaking the chain. Also, we need to make sure that the disinfectant that we're using is for the correct pathogens. So if you move up the chart a little bit and you see bacterial spores, you'll notice that you have to use a bleach product for that. And that's the example I gave earlier. We had a breakout of a spore, so we had to switch our disinfectant to bleach until we had that spore under control. And a lot of times that happens on toilet seats. So if you do have a guest that has diarrhea, you may want to consider using bleach for that surface, for that porcelain. So while you have all the tools needed, we're finding that lots of people are not using them in the right fashion or on the right surface at the right time. So it's important to have an educated team and resources that you can call upon, especially with the high turnover of our staff. One more example is gyms. Right now, public gyms and hotels have either stopped operating or they're allowing guests to clean off their own equipment. So we need to remember that a disinfectant used in gyms has to be used according to the manufacturer's instructions if you do want to kill pathogens. That means allowing it to dwell for the appropriate time. If you leave it up to the guest, you can't be sure that they used enough chemical to cover the surface or allowed it to dwell to the proven factual time that is needed to kill those pathogens. There are many more eyes on us than ever when cleaning and disinfecting. So it's imperative that our staff are hand washing appropriately, they're wearing and changing PPE at specific times, and cleaning and disinfecting properly. You ever watch someone make the food at the restaurant, like if it's got an open kitchen? Or do you remind your doctor or nurse when they walk into your room to hand sanitize or hand wash? Or have you ever watched someone clean it at a hotel lobby and see that they start with the toilets before they move to the sink and they don't change their gloves in between? They use the same pair of gloves. Again, we have more eyes on us than ever, so it's important that we list out our expectations for cleaners and ensure they're following the correct steps. And our best practice to control and prevent infection are to know the pathogens, don't come to work sick with a pathogen, wear PPE, follow cleaning steps and disinfecting steps properly, and using hand hygiene. So before we get into a specific best practice for cleaning techniques, it's important to understand some of the definitions. Now, I've already used the term cleaning and disinfecting many times already, but we need to fully understand the difference in cleaning, sanitizing, and disinfecting, and sterilizing, disinfecting and sterilizing. You and your staff should not promote doing something that is false. For example, If someone says, oh, you can sit at this table here at our cafe, it hasn't sterilized. In fact, no, it hasn't. Sterilize is something and a phrase we should never use outside of healthcare. So there's actually a big difference in these terms. And I'll simplify it for everybody. Cleaning is the removal of dust, soil, or items such as dirty napkins or removal of towels. If you remove those things, you can say, I've cleaned that for you. Sanitize means the reduction of pathogens or germs. It's completed usually on like food prep areas or in restaurants, cafeterias. Disinfecting kills most pathogens on a surface. This is done in rooms, guest rooms, and public restrooms. And sterilization, that destroys all microbial life. That is never completed in hotels, and we should never use the term sterilization. It's very important that your team knows this. It establishes credibility with you and your team as well as with your guests. One more important concept to know is standard precautions. That's a CDC term. It means treating everything as if it is potentially infectious. So you're always going to perform hand hygiene. You're always going to use the correct PPE, which is mostly gloves in our world. And right now, everyone's wearing a mask. And then handling items such as linen and waste as if they are contaminated. Every guest, every time, should get the same treatment. Standard precautions is not just to protect visitors, it's to protect staff too from being exposed. CDC guidelines encourage employees to engage in frequent hand washing or the use of hand sanitizer too. So washing hands with soap and water is the preferred method, but if it's not available, alcohol-based hand sanitizer at no less than 60% should be used. Dispensers need to be placed at key guest and employee entrances and contact areas. And at a minimum, that is the lobby, reception area, employee entrances. This can include restaurant entrances, meeting spaces, elevator landings, pools, exercise areas, and other areas where there's a high level of foot traffic. And when it comes to choosing hand washing versus hand sanitizing, there are some things we need to remember. You have to wash your hands if your hands are visibly soiled. And you have to wash your hands after you use the bathroom. Hand sanitizer should never be placed in a public restroom or bathroom areas. And some best practices actually mandate that you have to wash your hands after cleaning the toilet. So in healthcare, we actually have staff wash their hands after cleaning any public restroom. You cannot use hand sanitizer. And then lastly, some manufacturers recommend 8 to 10 times of using hand sanitizer, hand washing in between, just in case there is any debris on your hands. Now, respiratory etiquette, that's another healthcare term that could or should be applied outside the hospital. With all of us wearing masks right now, it's a little different. It's a little funny. I don't know if any of y'all have sneezed into your mask yet. It's unusual with what you got to do. Do I take my mask off? Do I just sneeze in my mask and sit in it? So, but typically respiratory etiquette is sneezing into your elbow. So it's like a vampire cough. So now we're going to go over tried and tested cleaning techniques. These are items that we should have on our observation checklist, and the manager at your resort should be using when working with their teams. And I believe Dan is going to share an example of an observation checklist with everyone who is on this call. So first is cleaning top to bottom. Always start top to bottom. Why? Gravity. Any dust or debris dislodged from high surfaces or top cleaning naturally falls to the lower bottom surface. If you begin with low to high cleaning, it increases the risk of recontaminating already cleaned surfaces. In healthcare, high dusting is the first thing we do in any empty room. Next is clockwise to counterclockwise. You ensure you hit every surface needed for cleaning and disinfecting. And we train staff to start at the front door and always move clockwise or counterclockwise. Cleaning should not be haphazard, and we shouldn't ping pong around the room hitting items. I know a lot of places like to first spray surfaces. A lot of hotels I've been visiting will show me that they like to spray the toilet first so that it can dwell. But actually in healthcare, there's no spraying disinfectants at all. We can't use it for a few different reasons. It doesn't ensure all surfaces are touched by the chemical. So if you walk in and you just spray a toilet, you can't guarantee that that chemical landed on all parts of the toilet. And then it also increases the risk for respiratory particles to go into the air, and then people would or breathing them in at that point, especially patients on respiratory machines, but just the staff using the disinfectant itself. So not only should each room start with high to low, it needs to go clockwise or counterclockwise, and I would revisit spraying chemicals at all. Next is cleanest to dirtiest. This is an important one that a lot of people don't adhere to. So as you heard earlier, lots of pathogens are spread through body fluids. So starting with the bathroom really doesn't make logical sense. So if you start with the cleanest area, you reduce the likelihood of spreading contaminants from dirtier areas to cleaner areas, and this increases efficiency and safety. Another best practice is to use multicolored rags too, one for the restroom and one for the room. The guests not only see you changing the color, but it helps staff to remember to use blue for the room or orange for the restroom, so the guests can see that you're using two different rags and they don't have to worry about that same rag coming from a toilet to their bedside table. And the newest technique is actually unidirectional wiping on surfaces. So unidirectional wiping is when you wipe a surface in one direction and then you pick up your hand and you go back to the beginning and wipe in that same direction. It's not casual, there's no wax on, wax off. It ensures the solution is applied to the entire surface. And you should also change your cloths frequently. So if you're doing this and you need a new rag because you don't have enough disinfectant, make sure and go back and get a new one and not re-dip your rag. And as a reminder, carry everything away from the body. Soiled linen could have unseen pathogens, body fluids, or objects in them. So often staff will gather the linen right in front of their body and then put it into the bag. So making sure we carry it, one with PPE on, but then away from the body so it doesn't open us up to injury or illness. So now you know the pathogens and the best practice techniques. We now need to ensure the staff are using the correct products and processes and are properly executing them so we're safe for our team members. And templates. I highly recommend templates at any of our carts, our closets, even outlines the process and the order which we can do. You can create templates for almost every part of our job, actually. It ensures they're going in the correct steps and everybody's on the same plan too. So here are some tips for chemical selection, item selection. So in healthcare, we do not use cotton mops. Cotton mops are less absorbent than microfiber. They're less effective than microfiber at eliminating bacteria, and it requires more chemical use. Cotton rags, same boat. Cotton rags are less absorbent than microfiber, and they reduce the ability of the solution to kill the pathogens. Spray bottles, as I mentioned before, healthcare actually, we don't spray any disinfectants. The only thing we do spray are air fresheners, but not aerosol air fresheners, and possibly glass cleaner. We actually don't use aerosol fresheners, that's the next one, because they create respiratory issues for employees and they're a fire hazard. Aerosol fresheners mask odors as well. They don't eliminate the cause of the odor. And then off-the-shelf home chemicals. We shouldn't be using off-the-shelf home chemicals at all because a lot of staff like to bring in their Glade or their Fabuloso, whatever they're comfortable with using at home. But we know that we can't bring those in because they're not approved and we don't have a SDS, safety data sheet, for them to have on file. This next slide is a chart that lists the 5 most basic types of chemicals used in a housekeeping department. Most likely you have all these already, or you probably have a much longer list than this as well, but it's really important to note EPA registered hospital grade disinfectant. So that's a disinfectant, a germicidal disinfectant that has been proven to kill viruses such as HIV, HBV, hepatitis, COVID, etc. And I bet many locations are already using a product like this already, but the important part is that you're using it correctly. Letting it dwell is number 1. This chart is also an example of where a chemical company should be providing education for you. A quality vendor will work with you in your environment, provide cleaning details for each chemical on what surface that it can be used on. Dwell time. Now I've mentioned that a few times already. Dwell time is very important. Not only that you're practicing it, staff also needs to know what that means. So the dwell time is the amount of time that a disinfectant must remain wet on a surface to kill microorganisms. It not only will tell us how much chemical to use, but how long to let the chemical sit for. And knowing this, knowing the dwell time impacts how much disinfectant to use and how long to leave it wet. And we never dry surfaces in healthcare as well. So as mentioned, all eyes are on us. So now donning and doffing PPE are highly important, not only for guests, but also for the safety of your team members. Donning means to put on PPE, and this has to be done at appropriate times. Before you change the garbage, before you change the garbage, you put on gloves, and then after you change the garbage, putting on new gloves before touching anything else. And doffing, taking off PPE. Gloves must be removed prior to touching non-contaminated items. So when you're done cleaning the toilet, taking off those gloves before touching anything else with your toilet gloves. And I like to put a little note in here. So you see the NIOSH symbol at the bottom. That is really important because not all PPE is created equally. So a lot of people will go shopping for different type of chemicals or items or PPE, and they're not necessarily the tried and tested ones. So a lot of things will have a little NIOSH symbol. If you're on Grainger, you'll see where it says NIOSH approved for whatever goggles or gloves you're looking for. So I do recommend using that rather than going for possibly one of the cheaper items before ordering anything. So all these behaviors, knowing the pathogens, following the cleaning and disinfecting techniques, wearing PPE appropriately, following hand hygiene, work together to create a safe and hygienic environment. But it can be a lot, not only to make the policies, the education, but then to be at 10,000 places at once to make sure staff are actually following them. So getting our desired results. There are 4 ways to aid in the success of an infection prevention program at your hotel: training, inspection, observation, and testing. So training is the education or instruction, whether it's formal, hands-on, or virtual. Inspection can be something like a visual inspection, or maybe you're using blacklight inspections. Observation is watching someone or watching the process occur, making sure glove changes are happening or they're doing the right cleaning steps in order. And testing. So an example of testing I have listed here is using an ATP machine. These are widely used right now in hotels and healthcare facilities. It is a rapid test. Now ATP stands for adenosine triphosphate. It basically measures energy molecules left on a surface, but the test itself is a little handheld device, and it gives you a rapid test, and usually about 10 seconds. It quickly assesses the cleanliness of a surface. So it's real quick, it's just an easy swab. It's quantitative, so you can actually measure it as well. And it's used in food process plants, healthcare, and hospitality, and it's relatively easy. You yourself can do it, or a third party, a non-biased third party can do it as well. The most common spots to swab are the high touch points. So here on this chart, you'll see 25 listed out. On average, there's about 25 high touch points in a room. And if you swab some of the high touch surfaces in a guest room, you can gather whether the staff member is using enough chemical, or if they're cross-contaminating, or maybe they're not using enough elbow grease. So it's a great teaching tool that is easily documented. So I believe Dan is going to share a graphic with everybody on this call afterwards that has the high touch points listed out as well as this picture. So I hope I didn't overwhelm you with this information. There's a lot more that I could share you from my experience, starting from flipping checkout rooms to completing safety audits. But my best piece of advice that I can give you is to have a consistent education program with inspections, observations, and auditing. That has to be done. Because really you can educate until you're blue in the face, but if they aren't practicing it, then what's the point? I work with a lot of different organizations to make sure their protocols are up to date, observe behaviors of the staff, and to test to make sure the results are achieved. And this has had the most profound effect on the hospitals and hotels that I've worked with. There should not be a lot of variables either. So if you have someone say, well, this is how I like to do it, or this is how Dan likes to train, you got to cut that out because it should be a standard across the board. Education and testing needs to be fresh and engaging too, because you have to get staff buy-in. And we're all very, very busy. So I don't suggest reinventing the wheel either. Partner with someone who can do the legwork for you and pool the ideas and checklists together. Remember, the vendors, they work for you. So thank you so much for your time today. If there's any other information you'd like or have additional questions that we can't answer today, I'm sure you can reach out to Dan at Chris anytime, and you can request checklist or any advice or assistance. Thank you.
Thank you so much, Ashley. That was great. I just want to remind everybody here that there is the questions box in the system here, and please, if you have questions, share them there, and our staff is monitoring that. One question that came in or the first question that came in on there is, should hotels be offering a stayover service for room cleaning?
Can you be more specific? A stayover service? What that specifically
Sure.
referring to?
So typically, you know, I think most guests are accustomed to housekeeping coming into their room every day and cleaning the room. And many properties now have decided to suspend that. So the room is cleaned, obviously, and disinfected before you get there. But if say you're staying at a hotel for a week, you know, people will typically put their trash outside if they want to empty it at night, or a call if they want a refresh of towels. But we don't have housekeeping staff that are coming into the rooms and turning it over during the stay.
So you're asking if you should spend the daily maintenance of the room until the staff check or the guests. If employees are following the right PPE, putting the gloves on, most of these particles, the pathogens, aren't going to linger in the air for long periods of time. Now, I don't recommend, my opinion, going in there while the guest is in there, if that can be avoided altogether. So there's still social distancing. But if they're wearing their mask and they're wearing their PPE and they're going to hand hygiene properly, I don't know what the harm is. We have to go in patient rooms every day, even while the patient's in there. So again, I don't recommend going in there while the guest is in there, but my best advice would, if the staff is following everything they need to, that is still a possibility. Oh, I can't hear you, Bill.
I'm sorry, it's like every Zoom call I've been on for the last 9 months. No, can you give us some examples of things that people can do to break the chain?
Absolutely. Hand hygiene will almost break every single one of those links. So having hand sanitizers on their carts, every cart should have its own little pump hand sanitizer, and having them at all the different entrances, maybe having one in each housekeeping closet in case the cart one gets empty. Wearing PPE, and then reminding staff not to come to work sick. Those are the big ones to break the chain on every single link.
Great, thank you. Another one we have here is, what are some examples of resources that people on this call can use for questions surrounding this in the future?
I highly suggest partnering with all of your vendors. I mentioned that once, that the vendors really work for you, and put them to work. They should be giving you all these solutions. You shouldn't have to be chasing down safety data sheets or what can I use this on. You should have a direct contact with each one of your vendors that can provide all the information from what chemicals best in a restroom, how long does it need to sit for here. So, or Blue Canary is a good example of an organization to partner with that can get you those answers.
Great, thank you. Another one that we got in is hospitals obviously have a lot of hard surfaces that you're cleaning, but in hotels we have a lot of soft surfaces that we're cleaning. So how do you recommend we approach that?
There's actually not a ton of information about soft surfaces right now. More education has been done on the vinyl, the porcelain, all that. So it's new to think about, and they're testing it all right now. But again, I would not use a lot of even the chemicals I talked about today on soft surfaces. So partnering with your chemical company, because if you, like we all know, if you use bleach on that couch, you're going to ruin that couch very quickly. It's going to be an ugly couch very soon. So being very specific with what chemical you use on soft surfaces is important, and your chemical company needs to guide you in that.
Okay, great. Have a couple more questions roll in here. What are the other ways that you would suggest, or what other ways would you suggest cleaning other than spraying?
Yes, okay. I get this question a lot. So we have, I don't know if you can see me, but we have an open bucket on top of our cart, and it's just a Rubbermaid yellow open top bucket, and we put our chemical in there with our microfiber rags in there, and it charges. It's a charging bucket, and each cart is equipped with one of those on top, and you just pull your rags out one at a time. Now you're going to go through a lot of rags, but a pour top is also an option. So if you don't want to spray, which I've never sprayed in any hospital unless it's glass cleaner or an air freshener. If you don't want to do that, a pour top to pour it on the rag.
Great. I think I actually got two questions on that one. And somebody else just asking if we'll be sharing this PowerPoint. Yeah, we'll actually be sharing a video of this whole thing, so you'll be able to access that at our website later today. So it looks like that's all the questions that we have. So Ashley, really want to thank you for being here and helping out our members. We really appreciate it. And Dan and the rest of our friends at Blue Canary, thank you for investing the time and the energy in putting this presentation together.
Thank you for having us.
Yeah, and Bill, if I could just say thank you very much to the Wisconsin Hotel and Lodging Association, Bill, Connie, and Monica. Thank you for organizing this wonderful event. And again, it's now more important than ever to band together as an industry so we can all come out of this stronger together. And I know everyone who was on this, and judging by some of the questions, I know your heads are probably swimming. And I wholeheartedly believe that it's critical and critically important for our hospitality industry to continue to build and strengthen our cultures of safety, not just now during these pandemic times, but all times. So we hope you walk away from this with a broader knowledge base and a strong desire to keep your teams and your guests as safe as they can be. Again, thank you to our hosts, and I'll follow up with you with the information that Ashley mentioned. And lastly, each hotel that we're working with has the right people. It has the right products. The area where we're seeing the greatest needs for improvement is making sure that everyone is using these products the correct way, not their way, but the correct way. So this is really where an on-site program of continuous education, training, and coaching has been the most effective and yielded the most measurable results.
Great, thank you, Dan. With that, again, everybody, thanks for being here today. We do have another session coming up next week already, and we'll be announcing some other sessions in the very near future. The next installment is going to be redefining hospitality in 2021 with ESG architecture and design. So watch your email boxes or go and sign up for that one on our website right away. And one thing that's last but not least, I want to remind everybody that our annual conference registration is open, and the early bird rate is through tomorrow. That's the Spring Symposium and Expo. The early bird rate is good through noon tomorrow, so please check out our website at wisconsinlodging.org and join us in Green Bay for a great, safe conference on March 7th. So thank you much again, and we look forward to seeing everybody soon.